Hi, I am Allison with the Sports Performance Tip of the Game, brought to you by DMC Physical Therapy and Sports Medicine. As an athletic trainer, I often get asked when to heat and when to ice after an injury. We like to use the acronym RICE, which stands for rest, ice, compression, and elevation. So when an injury occurs within the first 72 hours or about 3 days, it's important not to use the joint and allow it to rest. Then you can introduce ice, which will help to relieve pain and control swelling. Compression, like a bandage wrapped around that injury, can also help minimize the swelling and pain. If it's an ankle or knee, gravity pulls that away, making it more difficult for the healing to take place. So it's important to elevate the injured area. There are fancy ice packs out there, but one thing we have is something in the freezer. If you're past the 3-day mark or 72 hours, you can start to introduce some heat to the area, or just simply move the joint to allow some natural blood flow. But after that, and you're returning to sport, I would also use ice if any swelling returns.